Hello, my name is Aline Alves. I'm an assistant professor at the University of Brasilia, Brazil, Physiotherapy School. The title of my presentation is Prevalence of Constipation in Older Women with Overactive Bladder Syndrome. The present study aimed to analyze the prevalence of constipation in older women with overactive bladder, considering the female gender, age, and sociodemographic factors deemed relevant for overactive bladder and constipation. For the present study, we included only older women with overactive bladder assessed by OEBV8. The constipation was assessed using the round-tree criteria and the George and Wexner constipation score to describe each symptoms of constipation. Table 1 shows us the sociodemographic characterization of constipated and non-constipated older women. We assessed 42 older women and 19 presented constipation in association with overactive bladder, representing 45.2%, and 23 older women had no constipation in association with overactive bladder, representing 54.8%. Regarding the variables that we analyze, we have the mean of age, gestation, and vaginal delivery. The mean was higher in women with constipation when we compare with older women without constipation. And for the body mass index and the years of scholar, we have the higher mean in women with no constipation when we compare with women with constipation. Figure 1 shows us the distribution of the symptoms in older women with constipation. As we can see, we have all the symptoms that we have in George and Wexner score, distribution per number of participants that present the constipation symptoms. 31.5% of the older women had some difficulty or evacuation effort. According to the score 2 in George and Wexner, we have 57.8% of the older women that had some incomplete evacuation sensation and 42.1% that had some difficulty or evacuation effort and that had score 2 in George and Wexner. The figure 2 shows us the distribution of the symptoms of no constipated older women. As we can see, almost all the participants, the symptoms are in the score 0 of George and Wexner. When we talk about difficulty or evacuation effort, we don't have any one participant that complain about this issue. 21.7% of the older women had some incomplete evacuation sensation, according to score 2 of George and Wexner, and 17.3% had some difficulty or evacuation effort, according to score 2 from George and Wexner. In conclusion, the prevalence of constipation in older women with overactive bladder was high compared to studies evaluating such incidence in the general population. Older women with constipation presented higher complaints in all symptoms included in the constipation score of George and Wexner when compared to older women without constipation. Regarding the sociodemographic profile, constipated older women had higher age, higher rates of pregnancies and vaginal delivery, and a lower educational level comparing to the non-constipated group. Thank you.